We focus a lot of our needs on, we need to deliver a good patient meal and with the nutritious requirements that are associated with it. So it's based on that, we actually put our demands on the products that we buy. So it's more that way than actually looking at costs in the requirement or the procurement process. And then we focus on putting on what we need. It's not like we need a specific brand. It's what do we need in a brand. And then it's always a scale of, the commercial brands or the own brands of the supplier. Then it's the requirements. We need to make a dish that's tasty, that fulfill the nutritional requirements that we have on the meal. And from that, it should also be easy to produce. And then it's a cost. So it's kind of those four that needs to be balanced. And then as a secondary is environmental requirements. But it doesn't really make any difference in the dish if it's an organic milk or plain milk. So that's a cost environmental discussion that's made in the procurement group with the. On the other hand, the chefs that makes the menu and the dishes, recipes, they focus more on nutrition and taste. We don't have any requirements on social value in specific. Then we always try to procure or put our demands in that way that we get local products to make sure to buy from Skåne and Sweden.
How do you do that?
It could be looking at now milk is maybe not the best example, but you could make sure, do you want the size of the package? That's a way to make sure that they can deliver. You could put, for example, when we buy fish, you can say it should be fresh fish. You can only be transported 4 hours. Then we exclude a lot of suppliers. Also putting up now if you want to buy bread, for example, then it should be delivered. It should be freshly baked. With the definition, that should be delivered before 7. Then it can't be baked too far away. So you have to find your ways to be able to, or to ensure that you have suppliers locally that can offer, but you also have to ensure that there's more than one supplier that can offer. You can't like put it so narrow, so it's only one, because then that's not okay. It's a tough process, and it's a lot of engagement from our politicians. They want to make sure that we follow the guidelines they set with different focuses. If it's environmental or economical, it's usually them that say we can do this to fulfill the environmental programs, but with this cost. And then we put them up with the option of deciding which way we should go. The politicians are very hands-on in the procurement process, because before we publish our procurement documents, they see and look at our demands, and then they can go in and discuss specific demands. For example, I had a couple of years ago when we were buying meat, they were in discussing in a top requirement regarding modified soy in the food for the animals. So it could be very, very specific. It's been a long process. The resistance hasn't been that big, actually, not from politicians, because it's been very well anchored with the politicians. It's been a long process to ensuring that the purpose of this is actually good for everybody. It's good for the economics, it's good for the patients, and it's less work for the hospital staff. Then, of course, when we roll out into the wards, it's tough to change. And I've been doing it this way the last 20 years. Why change? And it's a lot of information, a lot of education, and most people actually much more satisfied now than before, because it's easier for them. There is a flexibility and makes it better for the patient, because they eat more, get more protein, more calories. Then hopefully they will leave the ward maybe just an hour earlier, but still it's good for everybody.
We have region-wide goals that apply to all departments in Region Skåne, and that we have to accomplish by 2030. And it can be very hard for all the departments and special areas that work with food to break down a region-wide document. So we have this environmental management system that breaks down the region-wide work into something that's more close to home or heart for the departments, which makes the managing more unified and make sure that we all work towards the same goals. And concerning staff food, we're now releasing one of a management system document that tries to reduce food's climate's impact, food that is meant for staff, that is catered, and also reducing food waste. And reducing food waste for staff members is also more like a habit. Like when we have some leftovers from a big event, it's put out for everyone to take home with them. And it's a little thing to do, like asking, do you want to take this home with you? But we're trying to encourage everybody to have that perspective of not leaving any food behind.
Now with this new concept, we will end up having 2 centralized kitchens, and we cook everything from scratch, with exceptions of jam and ketchup and such products. But we also buy like peeled potatoes and chopped onion, because we can't add any value with those products. So we make sure that where we can add a value, we make it ourselves. And then we'll cook it in our 2 kitchens, and then it's a cook and chill process. So we chill it down and pack it in trays with the modified atmosphere, and then distribute it over the whole region to the 9 hospitals that we have. We're around 4,800 meals a day that we're going to produce. When we deliver the trays, they put in a fridge where we set predefined levels. So there are always a certain number of dishes in the ward that you can eat whenever you need them. You heat them up on demand, so it's freshly cooked, if I say that. But it's from order to meal is maybe 10-15 minutes if it goes really fast. And it could be adapted to when you're on an exam or you come up from the emergency room at 10 o'clock, you can still get your meatballs. We have a special tray. So we put it, when we have it and pack it in the kitchen, we put it down in a tray, like a normal plastic tray, seal it. And when we come to the ward, they put it on a plate, heat it up, and then we remove the bottom and lift it up. So it would actually look the way that we want it to look on the plate. With respect to sustainability, our main focus has been food waste, because we had an enormous food waste when we had our old system. Now with the new system, we see a major reduction. We're down like 12% approximately, percent units, I would say. That's a major part. And also with not cooking and serving directly, it's easier for us to plan, make sure that we use everything we need. Even if we produce on a prognosis, we still have with a long shelf life time, it makes it easier for us to adapt to the needs when going up and down, because it's a variation over the week. The new concept will enable us to save a lot of money. We're supposed to save, initially we had an estimation of about 50 million Swedish kronor a year. Now I think we'll end up around 30 because it's a change slightly over time. And it's due to 2 main reasons. One is reduction in production units and production personnel. We'll produce 4 times as much food with the same personnel as we did before. And that's personal cost. And then the second is food waste. By reducing, to make sure that all the meals that are served, it's actually served to a person or a patient that needs it. Because before we have ordered the food with relatively long heads up, and then we don't know if the patient wants to eat, if it's still in the ward or if it's gone home.
The hospital food has become more resource efficient because it has decreased the food waste a lot. And that's due to a number of factors. One factor is it being home cooked and more tasty, more appetizing. And also that the patient can get the food at a time when it feels hungry. So it's delivered not at an hour, given hour where the patient doesn't feel hunger, but is delivered at the right time for eating this meal. And then there's also a dealing of the surplus food that's handed out to the caretakers or family members to the patient at a small cost. So there's different things that have decreased the food waste from the hospital food.
Our menus are set up in accordance with a quite extensive demand list. It's or two documents in principle that we have. One is more of how we should make sure that it's a variation in the menu. There should be something for everybody. There should be fish and there should be meat, chicken, whatever. There should also always be potato and rice. So we are not fix the menu so you can't choose. Then we also have a document that specifies all the special menus with respect to all different illnesses that's in the hospital that we also need to supply with it. Allergies, or you need your newly transplanted, you have one type of meal, or you're on dialysis, you have a different type of meal. That's specified by the healthcare personnel or the healthcare. And then we have to adapt based on their requirements. We have to make a dish that fits into requirements with respect to, it could be protein or it could be salts or whatever they have required. So it's a quite extensive number of dishes that we make from outside the normal menu, where we have our menu. So I think we have 40 different special meal types over the normal. It is challenging, but the people actually working with the menus, they have done a major work to make sure that we can reuse things. That the menus, if we need it for mashed potatoes for one type of food, then we make it in such a way that we can use it in more. Our goal for us is to make the meal situation, the silver lining of the day. You should look forward to get a lunch. It should be something you look for, because your visit to a hospital is not very good. And we've been working a lot to make the language in the menu very, like I say, describing, so you can, even if you can't taste it, it actually makes you want to eat it. If it's a lemon sauce, it should look like a lemon sauce, it should taste lemon, and you should be able to feel the dish and make that, this looks really good, instead of getting something that's chicken something. Yeah, it's not food, it's a meal. And a meal is not just food, it's also the environment, the menu. You should be able to select when and what I want to eat, and make sure that I'm longing for those meatballs. They're really good. Or I want some other dish, and you can eat it every day if you want it.